Good morning, everyone. Thanks for coming out to our meeting. This is our second meeting of the Ohio Society of Interventional Pain Physicians. This year, we partnered with Kentucky. There'll be physicians from Kentucky also presented throughout the agenda, and then they'll have their own opioid session on Sunday. So today I wanted to talk a little bit about introducing ASIPP and OHSIPP to people who may not be familiar with them. I've been involved with them for about 15 years. So just real quickly, this is the mission statement. Essentially, we're looking to promote, proper education and delivery of pain management care. We're also looking to advocate for coverage of these services. The idea is we want to have everybody speaking the same lingo and practicing the same way. Here's our ASIPP, OHSIPP goals, and I won't read them all to you, but you can see there, very at the top, preserve coverage for interventional pain management, where ASIPP is one of the leading organizations that are involved in advocacy for coverage of these treatments. Patient safety, the high principles, policies, and practices. And you can see there at the bottom, improve practice management, compliance, decrease fraud, waste, and abuse. So we want to have everybody practicing along the same line and doing good scientific, evidence-based care and ethical care. So ASIPP is organized this way with the CEO, president, executive board. Lax Manchakanti has essentially been started the organization about 20 years ago, and he's been CEO since. The president, of course, every year, that's Hans Hansen out of North Carolina. He's the current president. Next year is going to be Sudhir Dewan of New York State. So OHSIPP is set up in a similar fashion. Dr. Malsoin is the CEO. CEO is essentially a permanent or continuing position. The president is every 2 years. I'm the current president. Mark Malinowski is the vice president. He's from Columbus. Him and his wife are expecting their first child right this weekend. I think they may have already delivered, so he won't be here. You can see the others. There are several open director spots, so we're looking to add some more. If you're interested in getting involved, please talk to us and let us know. So ASIPP can strengthen state societies by helping financially, getting the word out, providing speakers. And then state societies can also help by, again, getting the word out and trying to encourage membership drives, speaking to the state legislators at the state level, talking with our own state regulators about opioid prescribing and such. So you think of it as ASIPP as much higher level, talking to Medicare about Medicare reimbursements, and insurance companies will follow that. And at the state level, we're interacting with Columbus as far as reimbursements through CareSource, but also probably more importantly is state legislation as far as opioid prescribing, acute and chronic pain guidelines. That's all coming from in-state, and we're the ones talking about that. ASIPP is too big and busy to take up that fight. Academic programs, this has been a problem with ASIPP, and there's kind of working in parallel. The ASIPPs over here and the academic programs do their own thing. There are some academics that are coming over to ASIPP and ASIPP docs that go over to academic programs. So we'd like to improve that. Here at ASIPP, here in Ohio rather, we're lucky we have several pain fellowships, about 5. And for this meeting this weekend, we have presenters from 3 of them. Harsh Sastava from Cincinnati, also Cleveland Clinic. We have a couple speakers from Case Western. Salim Hayek will be speaking. And Mark Boswell, who's a huge ASIPP supporter, been involved with ASIPP since the beginning. He's now the fellowship director at Toledo. So we have contacts with the academics in our state, and I suspect that'll continue to grow. So how can we help ASIPP? Well, we can encourage membership drives, encourage supporting both ASIPP and OHSIPP through donations and membership fees, represent ASIPP in the teachings and our philosophy. And as I said, feel free to contact us to get involved with the services on the executive boards, whether it's ASIPP or OHSIPP, and support us through committees. So again, just remember my appeal to you guys to think about getting involved and helping out both with education and working with, meeting with legislators, but also supporting funds and supporting through membership and contributions to the PAC.